Hi, my name is Christine Bowen, and this is my first session. He will remain nameless for anonymity. Goal of the session is to have a treatment plan set in place. I will be setting a time and date weekly and refer him to a mutual help group. Techniques that I hope and plan to use for this session is motivational interviewing and trying to start the miracle question from SFT. You don't have to introduce yourself. Since this is the first session, I'd like you to state why you are here.
I'm addicted to meth.
Okay. And why are you here now? Are you ready to quit, or what is the reason?
My goal is to no longer need meth.
Okay. Now, since this seems to be an ongoing thing where you have been arrested and you are no longer working, I'm going to ask you what's called the miracle question, and that is, where do you plan to be in the next few years if you are to stop using meth?
I hope to be off meth, have a stable job, and be able to provide for myself.
Does anybody know that you're using?
Everybody.
Who is everybody?
My whole family.
Have you confronted any of them?
No.
Okay. Now, what is your goal starting here then? So obviously, you're not going to just quit today. Do you have a provider that you see? Am I your first counseling session? Have you seen anybody else?
No.
So this is your first step?
Yes.
Okay. What about self-help groups like Narcotics Anonymous? Have you been to one of those yet?
No.
Okay. There are some in the Ionia area, and I can give you like an instructional sheet when we're done here, show you where all of those are. And I have different times set up too based on your schedule that you've given me previously. Now, I know this isn't an easy conversation. If this is your first time, how often would you like to start seeing me for counseling?
3 times a week.
Okay. When is your earliest availability then? Certain days that work for you?
Monday, Tuesday, and Friday.
The NA Narcotics Anonymous groups, they meet on Monday afternoons usually. Is that okay? Because I can contact them for you if you'd like.
Yes.
Okay. All right. Is there anything that you'd like to talk about, or do you want me to continue? So, you said that your family knows. What have they done to try and help you?
Interventions.
They
Multiple.
Multiple. Okay. So, what I would suggest is I would like to have a family meeting. It doesn't have to be ongoing, just a one-time thing. Can we do that for the next session?
Sure.
Okay. And how would you feel about starting an outside, it's kind of like a self-help group, but you meet with other Narcotics Anonymous, kind of like that, but instead of meeting in an enclosed space, you would go to like a hiking trip.
No.
That doesn't interest you?
No.
Okay. I'd like you to start talking. What is the hardest about quitting?
The quitting part.
Getting it
Obviously.
started? How often do you use?
Every chance I get.
Are you thinking about it now?
Oh yeah.
What are some of the cues that you've noticed? Like, do you have a certain,
I grind my teeth.
what I mean to say is like, what emotional factors kind of contribute to you wanting to do it? I know that you're probably dependent on it and your body's automatically wanting to do it, but I'm thinking that there's something deeper. There has to be, how do I word it? Like, for example, when I get stressed at work, I like to indulge in chocolate, which isn't, a huge deal, but if I continued to do that and eat more every time I get stressed, there are other complications and consequences that could come from that. Obesity, and then health risk from that. So I'm trying to help you identify which emotional factors kind of cue your desire to start using meth.
I don't know.
Okay.
I don't have emotional cues. I have bodily cues. Grinding my teeth. Feeling anxious.
When do you feel anxious?
All the time.
Nothing specific?
No. My girlfriend's a big trigger.
What does she do that helps trigger that?
She stresses me out.
Okay, what does she do that stresses you out?
Complains.
What does she complain about?
Everything.
Have you tried helping her with those?
No.
Does she know that it bothers you?
Oh yeah.
Okay. Does she use?
No.
Now, if she complains all the time, does she see anybody?
No.
Have you thought about a different environmental factor?
No.
What if the reasoning is people that stress you out causes you to use?
No, just her.
Okay, well, she's just your girlfriend. Have you thought about a different girlfriend?
No.
Being on your own?
No.
Why not?
Because I lie and I use the money that she gives me to buy meth.
But you're trying to quit. So why wouldn't you want?
She's financially stable, and I am not. So I use her funds for my own needs.
Okay. That's good. I'm gonna stop there, and we will pick up again tomorrow, since tomorrow's Tuesday. I want you to take home an assignment, and I want you to write down the different cues when your girlfriend stresses you out and you feel the need to use. I want you to write the specific situation. Something she said, something she did. Write it down. Okay? Okay. It was nice to meet you.